Hi everyone, this is Summer, lactation consultant with Done Naturally. Welcome to my channel. Today we are talking about breastfeeding and tongue tie. Woo woo! Oh my gosh, this is everywhere. It's like freckles all over the place in conversations, forums, threads, comments. We're gonna talk about it. So we're gonna talk about what tongue tie is, the prevalence of tongue tie, the methods for revision, and post-wound care. So let's jump in. Tongue tie involves the frenulum, and the sublingual frenulum is underneath our tongue. It's a thin, elastic piece of tissue, and we all have it. Tongue tie is where the movement of the tongue is restricted because of the frenulum, making the tongue not be able to do what we needed to do. When I talk to families, I'm going to explain it simply. When someone is eating spaghetti and you get messy all over your face, you need to be able to use your tongue to clean your mouth. You need to be able to extend your tongue, which is reach it out. You need to be able to lateralize your tongue, moving side to side. You need to be able to elevate your tongue, lifting it up. If a tongue cannot do that, they may not be able to transfer milk properly, which means move milk, manipulate it out of the breast to themselves. We need mothers to have happy nipples. We need babies to gain weight, have enough poops and pees, grow, develop normally. Those two things, baby and mom, are incredibly important. If we have a mom with happy nipples, if we have a baby that's growing and developing and peeing and pooping well, nothing's wrong. Everything's okay. If something in that group is not going well, there needs to be further investigation. And what do I mean by investigation? I don't mean looking at a picture. I don't mean just looking inside of a mouth. You have to look at many things. Not only are we looking inside the mouth to look at how that tongue can move, we're doing a suck assessment, and most importantly, we are evaluating and observing a feeding. What does that latch look like? What does that milk transfer look like? Are they moving milk out enough and frequently enough to be able to gain weight? That's incredibly important. You can have a baby who, when you look inside their mouth, you think, oh, yeah, that looks like a tongue tie. But when you observe a feeding, everything looks great and mom's perfectly happy and comfortable and they're gaining weight. Then you may not necessarily need to have that frenulum revised. If you have a tongue that doesn't really look like it's tied, but when you observe a feeding, something's not working, milk transfer is not happening, mother is in pain, some further investigation needs to happen. And guess what? It doesn't always mean revise the frenulum. Sometimes latch correction, a nipple shield, body work, massage, other things are at play. It's not always tongue tie. What I want to say today, and not everybody's going to like me saying this, but oh well, tongue tie does not fix everything. It doesn't fix burping, fussing, sleeping, gassy. Tongue tie is not a cure-all. And way too often right now, people will tell their story. My baby is really gassy. They have a lot of burps. They're not sleeping well. They want to nurse all the time. And people jump out and say, is it ties? That's not helpful. There are so many other things going on with feeding that need to be squared away first before we even think that might be it. So it's not ties. They don't fix everything. Did you know that the prevalence of tongue tie, according to the evidence, is 3 to 5% of all babies? All babies. That's not very many babies. For those babies, they need to be evaluated and likely revised. But for the rest of babies, they don't. And if you look globally, which if you've seen my channel, this is one of my favorite things, nature and species are very smart. It would be really unusual if babies were born not being able to feed. We wouldn't keep continuing to be. And there is absolutely no evidence or research showing that the prevalence of tongue tie is increasing. It's not. People are just talking about it more. And unfortunately, there are providers out there that are revising frenulums that do not need to be revised. And that's not okay. Okay, let's also talk about revision methods. So right now, according to the research and the evidence, the scissor revision is the one that is the most successful. That's a very simple procedure. It can be done outpatient. There is very little bleeding because the frenulum does not have a lot of tissue or blood vessels or vasculature in there to bleed. There's also not much sensation there. I usually equate it to an elbow. So you can like pinch forever this skin on your elbow and nothing hurts. Very similar to that frenulum. It's a super simple procedure. It's almost done before it's begun. Many people can get that procedure done in those first 3 days after delivery. Many pediatricians, ear, nose, and throat doctors, dentists, they can perform that procedure. There is literally no evidence, no research that laser revision is safe or successful. We need to do more research on that. So right now, you should proceed with caution with regard to laser revision. That means a lot of times that they're going in and lasering and doing much deeper incisions into the submucosal tissue underneath here, sometimes even up into the cheek, and sometimes even here in the upper labial lip area. There is no research that that is beneficial. I also want to talk about post-wound care. So post-revision, the best way to care for a wound is keep it clean and do not touch it. Many people are told a lot of different things. I've had families that are doing exercises where they're inserting their finger into the wound area, applying pressure, manipulating it, and the baby is crying and hates it. I want you to think about something simple. In any other instance where we make an incision, let's take, for example, the cesarean surgery incision. Are you ever instructed to press on a wound? No, it causes pain. It's horrible. It delays healing and it can create more problems. So when we're talking about post-revision care, we're talking about not touching it. Babies can breastfeed immediately after the revision, and breastfeeding itself, because we are moving the tongue, that helps to exercise the tongue and practice lateralization, extension, and elevation, because now it can do those things. But you don't need to do anything else. And in fact, there is incredible amounts of evidence right now that when we manipulate the wound, we are actually causing that mucosa tissue to create scar tissue, more and more scar tissue that grows and grows on top of itself, because that manipulating of it creates scar tissue. And that is what we're calling readhesion of the frenulum. It's not actually readhering. It's actually creating more scar tissue and pain and refusal of the breast. Many babies, after a procedure like that, if we're constantly manipulating it, create an oral aversion because of the pain. And then they don't want to feed. They don't want to breastfeed. They don't want to bottle feed. They don't want to do anything. But if we leave it alone and we stick to simple scissor revision for the babies that actually need it, we see improved breastfeeding. But laser is still out. We don't know enough, and we do know that it's incredibly invasive. Wound care is nothing except breastfeeding, no touching. And we know that messing around with a wound increases infection, pain, breast refusal, and more scar tissue. And we know 3 to 5% of babies have tongue tie. That is very small. So, did we go over what is tongue tie, the prevalence, the wound care, and the method of use? We did. So, that's what I have for you today. Most important thing, mom has happy nipples, baby's growing. Those are the 2 important things we have to have. If we don't have those things, you need a lactation consultant on your team, your pediatrician on your team, and possibly a support staff of an ENT or a dentist to evaluate everything, multidisciplinary, everybody looking at everything and watching a feeding. That's what I have. I hope you guys have a good day, and I will see you later in my videos when you subscribe. See you later.